Good evening, folks. This is a convening of the Central District Board of Health meeting for Tuesday, November 2020. It is now 8:02 p.m. I will introduce myself as acting chair. I am Betty Ann Nettleton from Elmore County, and I serve our county in conjunction with Representative Megan Blanksma. I will go ahead and call the meeting to order at this point, and I will take roll call by county, starting with Boise County.
Commissioner Sturm, here.
Thank you, Ryan. Valley County.
Mr. Hasbrook here.
Ada County.
Jane Young here.
Ed Eppley here.
Commissioner Laciando here.
Elmore County.
Representative Blanksma here.
Thank you, folks. Okay, moving on to our agenda. Number 3 under action items. Director Duke, are there any changes to the agenda we need to address?
Madam Chair, no changes to the agenda.
Okay, thank you. Under new business, we need to have a motion for our November 4th, 2020 board meeting minutes. Are there any additions or corrections to those minutes? Hearing none, I will ask for a motion to approve those.
I'll make that motion. This is El.
Okay, thank you, El. Is there a second?
This is Jane. I'll second it.
Thank you, Jane. Any further discussion before we move on with approval? Vote for approval. Okay, hearing none, I'll call for a vote by county, starting with Boise County. Boise County, Ryan? Can't hear Ryan right now. Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Laciando abstain.
Elmore.
Representative Blanksma, aye.
Okay, thank you, folks. The motion does pass. Those meetings for our November 4th, 2020 board meetings stand approved as presented.
Betty Ann, can you hear me?
Yes, I can now, Ryan.
Okay.
Yes.
Yeah, I don't know what was going on. It didn't want to unmute me.
Okay, I was calling for a vote to approve the minutes from our November 4th meeting.
Yes, ma'am. I was voting aye.
Okay, thank you so much. Appreciate that. Okay, moving on. Discussion and vote on November 24th board meeting regarding possible cancellation of the meeting. So the floor is open for discussion regarding next week.
Madam Chair,
Madam
this is Russ.
Chair.
Everybody spoke at once. Who spoke first?
Go ahead.
Madam Chair, this is Russ. I'm not going to be available for the evening of the 24th, and I was suggesting either cancel the meeting or I'll make somebody available to be acting director during that time.
Okay, thank you, Russ.
Madam Chair, this is Diana. I guess
Yes.
my question is, I don't know if it would be helpful to understand whether we should cancel the meeting or not, depending on the report that we get from Jim. What's your take on that, Russ?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Well, I think the situation, as you're going to hear from Kim, is getting progressively worse. I am going to suggest a public health advisory under action item agenda number 4. And I'm not sure, I guess, if we should have it or not. Like I said, I won't be available, but if the board is interested in possibly issuing orders, we could either discuss that this evening or you could talk about it further on the 24th. But I think absent making changes to the Ada County and Valley County orders or creating new orders for Elmore and Boise County, I'm not sure there'd be something that we'd need to talk about.
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
Thank you. I think that if there's a way to suspend the meeting unless we have to review orders, I think that's a good idea. I don't see how these meetings are productive just for all of us to sit around and discuss things. I think that Russ is going about things in the right way of just issuing recommendations. I think that's important. I think that's great they're getting out. But I don't think that we need to continue meetings just to review recommendations.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Thank you. Russ, a question for you. If we take an action tonight to suspend, but things change over the next 4 or 5 days, I would assume that we could convene an emergency meeting for that Tuesday if necessary. Russ, that would still be a mechanism we could use if things suddenly change in a way that's even greater than predicted.
Madam Chair, it's Russ.
Yes, Russ, go ahead.
That is correct, Dr. Epperly, and I believe we'd have to have 24 hours notice for action items if you were going to take action, so we'd need to make sure we get that done on Monday ahead of the Tuesday meeting.
Okay, thanks. I think it's wise just for us to consider that there are always other options that we could do with an appropriate public notification. So with that, I'd make a motion, Betty Ann, that we cancel the meeting on the 24th of November.
Okay, thank you. Is there a second to that motion?
This is Jane. I'll second.
Okay, thank you, Jane. The motion's been made and seconded to cancel next week's board meeting. Is there any further discussion before I call for a vote?
Madam Chairman, question from Representative Blanksma.
Yes, Megan, go ahead.
When is the next scheduled monthly meeting?
Russ, would you weigh in on that, please?
Yeah, it is December, and I'm pulling it up on my calendar. December 1st. I'm sorry, that's the next meeting. So you're looking for the regularly scheduled board meeting. So December 18th.
Okay, Madam Chair, comment on the motion
Yes. Go
or
ahead.
discussion on the motion.
Yes.
I would just say, since it's at the purview of the chair to call the meetings, I think that perhaps you just review the situation with the director and then decide if an additional meeting is necessary prior to the 18th, rather than setting these 1 week, 2 week meetings.
Okay, thank you, Megan.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
I'm a little confused now, Russ. I thought we had planned every Tuesday meeting unless we cancel. That's on the books now because of the nature of the pandemic. Am I mistaken? We're not talking about the typical Central District Health meeting on the 18th. We're talking about the next meeting that the board would convene to discuss the pandemic. That's still set for the 1st of December, is it not?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, I'm sorry, I was not clear about the question. So the normal meeting, the one that we meet 7 times a year, is scheduled for later in December. December 1st is in fact on the schedule right now that's been published for 8 p.m. and that's a Tuesday.
Thank you, Russ.
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
That's what I'm saying. If we're suggesting that we cancel the next meeting, which is on the plate, as the chairman, that you have the ability to schedule the meetings, and I think that perhaps this is the point at which you just go back to your regularly scheduled meetings unless Russ perhaps thinks they become necessary, and then within 24 hours notice you can call those. But from now on, I think that if we're not operating under orders or some other certain situation, that perhaps going back to the monthly meetings are more appropriate.
Russ, would you like to weigh in on that? Where we have the option to call in meetings if need be.
Madam Chair, my opinion on that is considering the situation we're in right now with the rise in both the cases, rise in positivity rate, and rise in hospitalizations for our three major health systems here in Boise, my recommendation is that we leave them on the schedule for now, and then you and I can talk as we've done in the past leading up to each of those Tuesday meetings. These are not the normal meetings, but the ones that were set around COVID. And then you and I can decide whether to cancel them or not based on what's happening in our community. I think that's what we've done so far. This is just a exceptional situation tonight in that I'm not going to be available. So I wanted to discuss the 24th meeting tonight so we can make a decision.
Madam Chairwoman, this is Representative Blanksma.
Yes, Megan, go ahead.
Just wanted to point out that scheduling meetings after the meeting for different times can be problematic when people are not notified.
Madam Chair, this is,
Yes, El, go ahead.
right now, there are a lot of people listening in on this meeting, and I've got a lot of good reports from folks. They like to see these weekly. I think we should continue weekly, except for maybe the 24th. I think just so the public can be involved in what we're talking about and what we're doing, I think we should retain them every week. And if possible, if Russ thinks we can safely move back to the 5 o'clock or 5:15 time slot, that we should consider that as well. But I want to keep meeting weekly as much as possible. We have too many people watching these.
Madam Chair, this is Ted.
Yes, Ted, go ahead.
I absolutely agree. This is not the time to slow down the frequency of meetings. If anything, we need to increase the frequency. My motion is just to cancel the 24th of November because Director Duke won't be there and the proximity of Thanksgiving. But since we have meetings on the book, we need to honor those for sure. This is the height of the pandemic. I am not in favor of anything that would change the weekly meetings on Tuesdays, other than next Tuesday.
Any further discussion on this matter? Okay.
I don't need to belabor it. This is Diana, but I would concur with Elt that people are watching and people appreciate getting the data firsthand from the health district. I think it's a government transparency responsibility.
Okay, thank you. I'm going to go ahead and call for a vote right now concerning the motion, which is to cancel next week's November 24th board meeting. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County. Ada County, Dr. Young.
Jane Young, aye. Sorry.
Ted Epperly, aye.
Commissioner Lasciando.
Commissioner Laciando, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you. Okay, motion passes to cancel our November 24th board meeting. And as chair, I will be discussing with the director as far as the necessity, if things change, to have our December 1st meeting. Does that sound reasonable to the board?
Yep.
Okay.
Yes, Betty Ann.
Yes.
Sounds good to me.
All right. Moving on to number 3, under our new business, we'll have a review of the COVID-19 metrics for criteria for determining quarantine and restriction orders for Ada County and COVID-19 activity in Boise, Elmore, and Valley counties by Kimberly Link, Communicable Disease Control Manager. Kim, the floor is yours.
Okay, thank you, Madam Chair. So I think while the presentation is getting pulled up, I will say in summary, I think Russ did a very good synopsis of where we're sitting right now. in that we are seeing increases in our number of hospitalizations. We're continuing to see increases in our number of cases that are being reported, and we're seeing an increase in our percent positivity as well. And I'll go through the data to support all of those summary statements. Just waiting for the content to pull up here. It's still loading.
Madam Chair,
Yes, Megan.
just a quick reminder to Kim. I know she probably already knows this, but some of us can't see the slides. So if you can be extra descriptive, that'd be awesome. Thank you.
Representative Blanksma, I definitely can do that. At this point, we are still waiting for the slides to show up, although it sounds like it is maybe not showing up on my screen. So I will move forward with my presentation. So on the first slide, this is titled, excuse me while I grab my notes, Central District Health Ada County Criteria Summary. So in short, we are seeing increase in our total number of hospitalizations. Over the past 2 weeks, we have seen a slight decrease in our ICU admissions among Ada County residents. Our case counts do continue to increase. We're in the position of having delays in data entry, and so we haven't finalized data for last week as of this point. So I haven't provided trend information at this time. However, at this point, I can say that our total number of cases reported among Ada County residents, I believe, will be in the range of 2,800 cases being reported. We continue to see clusters among the ones that we've been tracking, increased cases at the Ada County Jail, out at the prisons in CUNA, and our number of long-term care facilities having outbreaks is up to 39 at this point. And so we are continuing to see increases in the number of outbreaks in long-term care. All of this together, we're seeing, again, continued week upon week increases in the number of cases being reported. We've seen a doubling in the number of hospitalizations that have occurred over the past 2 weeks, and our percent positivity is increasing as well. So Dustin, if you could move to the next slide. So the next slide, this is the one titled Hospital Criteria. Again, this is not showing up on my screen, so I'm hopeful that it's showing up on the main screen at this point. The top set of graphs are the non-ICU admissions for Ada County residents. And over the past week, we've seen those numbers increase into the high 60s. And the overall trend for this is definitely upward. As I said, we've seen a doubling in the number of people who've been hospitalized as a result of COVID in the past 2 weeks. So definitely a troubling trend on that side. As we move to the middle sets of graphs, these are the Ada County residents who have been admitted to ICU care as a result of COVID. About 2 weeks ago, we saw our peak of about 17 individuals who were hospitalized in ICU care. We have seen those numbers come down slightly. I will say, though, that we can definitely anticipate that this number will continue to fluctuate in terms of those needing to see ICU care. As the number of total hospitalizations increase, we can anticipate that there will be a portion of those people who need ICU care and that number may continue going up. In the bottom sets of graphs, on the left-hand side, we have the number of patients who are in our Ada County hospitals in non-ICU care as a result of COVID. And again, you can see that there are very sharp increases in the number of total hospitalizations. Our hospitals are now at the point of having approximately 100 people admitted for COVID illness. On the right-hand side, we see the number of people in ICU care in our Ada County hospitals, again, seeing a sharp increase in those numbers. We did see a slight decline over the past couple of days, but again, anticipate that that number will continue to increase. And as we know with the hospital criteria, with hospitalizations, this is something that is not an immediate effect of new cases of COVID. Typically, individuals who need hospital care need this 1 to 2 weeks, if not a little bit farther into their illness. So as our cases continue to increase, we are going to continue to see hospitalizations increase, and we can anticipate that that's going to continue until at least a few weeks after our cases start to turn back downward. If you could go to the next slide, please. So the next slide is titled Disease Criteria, and this includes our case reports. This information, as I said, our data entry is backlogged in terms of getting our labs out and made into cases to be able to provide in this graphic. So what I will say is, again, as we look at our total number of cases, we are typically this week, from what I've seen so far, and last week, we're running in the range of over 300 cases per day being reported. I just looked at our data this evening, and on November 12th, we had 500 cases that were reported on that day. I think the last time that we had anything near that number was back over the summer, when we had a large number of reports that came in from mass testing out at the prison. The 500 cases that we received on the 12th, there may have been some asymptomatic testing that was included in that, but that's largely community-wide illness that's occurring. So again, seeing significant increases in our number of cases. The center set of graphs includes information of cases that are being reported, taking out those Department of Corrections cases. Again, as we look at the overall burden of illness in the community, our correctional facilities are still continuing to have outbreaks. They are continuing to have cases being reported, but by and large, the illness that we're seeing within the community is coming from the community. And if you could go to the bottom portion of the slide. So this is our information of case reports week by week. And what you can see in this graph is that as of last week, we were over 2,000 cases being reported. That's the highest that we had ever had to that point. Where we're sitting right now, at the time that I created this graphic, we had about 1,800 cases that were put in last week for data entry. We're now sitting at about 2,100 cases that have been put into the system. And as I said, I think we'll be sitting probably with 2,800 cases in total. And as far as looking at where we're sitting this week, we're over 1,000 cases having been reported already so far this week. So again, continuing to see very high numbers of case reports. If you can move to the next slide. So this next slide is the one that's titled Ada County Case Rate, Percent Positivity, and Emergency Department Syndromic Surveillance Information. So the top graphic includes our case rate information. This is the Ada County 2-week average daily case rate. It's the one that we use for making determinations of school categories. At the time that I pulled this graphic together, our case rate was at 59.54 per 100,000, which again, this falls directly in line with the number of cases being reported and was a record high for us. With the estimate of 2,800 cases for the week, I anticipate that this case rate will fall into the range of probably about 73 per 100,000 by the time that we get all of the data finalized. And in the middle graph, this is our percent positivity. I don't believe I was presenting this information previously, but I know that it is an indicator of interest. And what we can see with this percent positivity is that back in September, we had a positivity rate that was really around 5%. So in the range of seeing really good testing for the amount of illness that was present in the community. Since then, as our number of cases have gone up, our percent positivity has gone up as well. What this is an indicator of is that the testing that we're doing right now is not adequate to get a really good idea of the true level of illness within our community. And for the week of 11/1, we had the highest amount of testing, the highest amount of PCR testing that we've had in our district since this has been tracked. So there were nearly 12,000 people who were tested that week for COVID. And our percent positivity was at right about 13%. Again, like I said, 5% is ideal. 13% definitely is indicating that we have much more illness out in the community than our case numbers are showing us. Of course, one question that comes up as we look at percent positivity and as we see increasing testing is whether or not this increase in the number of cases is as a result of the increased testing, and the answer to that is no. If we were seeing more cases as a result of increased testing, what we would see is that that percent positivity would go down. What happens is that as we increase testing, we are testing more people who don't have COVID than who do, and so that would bring that number down. So having increased testing with increased positivity is an indicator that our case numbers are going up. That is a true increase and what we're seeing in the community is not an artifact of increased testing. On the bottom slide, I have the emergency department syndromic surveillance information. This is people who are presenting to our emergency departments with COVID-like illness that's defined as fever, cough, shortness of breath, with either a negative flu test or no flu test being done. What we're seeing in this indicator is that those types of ED visits are remaining reasonably flat at this time. Although I know with increasing amounts of COVID within the community, we are seeing increases in total emergency department visits, especially as we look at the full spectrum of COVID testing, or excuse me, of COVID-like symptoms. So in summary, as we look at this, we're in a situation that the trajectory that we're on is not sustainable in the short term. We're seeing that there are impacts in the healthcare sector. We're hearing of strain coming from these increased number of hospitalizations. And we're seeing impacts in all of our sectors as well. We're hearing a lot about impacts to childcare facilities. We're looking at having to close. We're seeing continued impacts to schools with schools having to make the decision to go into online learning because of staffing shortages. And as we look at our number of cases that we're having reported, as I mentioned, our case rate, our 2-week case rate for the past 2 weeks is most likely going to be in the range of 73 per 100,000. And as we look at COVID in a community and what's considered to be reasonably okay levels, the rate of 100 per 100,000 on a weekly basis really is where that max sits. So we're rapidly reaching that for our daily rate. And putting that into context, that means that we're getting as many cases in a single day, really, as we should be getting in a week at this time. And those numbers are continuing to increase. And COVID it's getting the better of us at this point in time. And we need to see changes in actions at all levels from individuals on upward in order to be able to bend the curve and get our community into a much healthier place. And that's the end of my presentation. I'm happy to take questions.
Thank you, Kim. The floor is open for questions for Kim.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
Thanks. So, Kim, when we originally, or when you put together this dashboard, I think it's been really helpful for us over the last several months to see the consistency in the report outs. But when we originally started looking at this data and having it be so Ada County centric, it was really when that cluster spiked over the summer and that was contained to Ada County. And I guess I'm wondering, as Elt noted, we have people watching from all of our counties. And I'm wondering if you could speak to our other 3 counties. You know, I very quickly pulled up the case rate for Boise, Elmore, and Valley County. I could name them, but I think it'd be better for you too. And, you know, we're noting that at this point we have Elmore and Valley in the red zone for schools. Boise's hanging on in yellow. So could you speak to what, you know, what does that look like and what are you hearing from those hospitals?
Sure, Madam Chair, Commissioner Laciando, we are seeing increased numbers of cases in all 4 of our counties at this point. As you mentioned, Boise County is the one area where our numbers have been lower base, total numbers, but also case rate wise. However, when we look at that 2-week case rate, their rates are in the yellow for schools, so still definitely of concern. In looking at our most recent information for last week, and again, data entry is not complete at this time, so it is interim at this point. Boise County, we had 10 cases so far that we've identified out of last week's reports. When we look at Valley County, we saw it the week before last, we saw a pretty sizable uptick in the number of cases. So Valley County had been in the range of 15, maybe 18 cases per week. And what we saw 2 weeks ago was that there were over 40 cases reported. So seeing that sizable of an increase in such a short period of time is definitely concerning, especially in an area that has such a small population. Where we're sitting right now for Valley County, we've identified 26 cases in this past week. Again, that number will likely go up as we continue to work through the data entry process. Elmore County has been on a little bit different trajectory from what we're seeing in Boise and Valley County. So we've been seeing the case numbers increase over time, really along the same timeline as what we've been seeing in Ada County. So this increase over the past really 2 months or so. I believe the high number that we reported out 2 weeks ago was over 80, so I think it was 82 cases being reported. Where we're sitting right now for last week's number of cases is at 77. So I anticipate that Elmore County will have as many cases as they did 2 weeks ago, if not more. So the situation that we have really across all 4 counties is equally concerning.
Follow-up question, please.
Chairman Nettleton, I'd like to, at this point, kind of inject my gratitude to Director Duke, because he has been diligently trying to educate our citizens here, our elected officials. He was down to the Mountain Home City Council meeting, which Representative Blanksma attended with him. He was to the Elmore County Commissioners meeting last Friday, and the following Monday, we met. Russ and I went down to the Glenns Ferry City Council meeting, and just as an outreach for education and trying to get the support of our elected officials primarily. So today there was an emergency meeting of our commissioners, and Laura and I were both on that meeting. And I just want to really extend to Russ our appreciation for, these are evening meetings that he's making the trip down here multiple times to try to get the word out. So thank you, Russ, from Elmore County.
Madam Chair, this is El.
Yes, El, go ahead.
Kim, it seems to me like, and you please correct me if I'm wrong, but we're seeing a lot more cases in all 4 counties. A lot more people are getting sick. But what I'm confused about is that our ICU numbers are down and our emergency department numbers are down. Do you feel like the public is just learning how to handle the disease, or how to treat it, or is it just people aren't reporting?
Madam Chair, Commissioner Hasbrook, I think as we look at our hospitalization numbers, again, when we look at our overall number of hospitalizations, we are seeing a stark increase in them. I think as we look at that emergency department indicator, honestly, I think that it's proving to not be a great indicator of what COVID emergency department visits look like, just because they do, it really does focus on such a small spectrum of the types of illness that people will have with COVID. And in terms of ICU numbers, I think if we look at the bigger picture of trends over time, we have seen a slight decrease over the past few days, but our overall ICU number of admissions is quite a bit higher than what we've seen before. So I think what we're seeing is really in line in terms of the number of hospitalizations and the number of people needing advanced levels of care, falling in line with increased case numbers. not only for us here in the Treasure Valley area, but we're seeing impacts of COVID statewide at this point.
Thank you.
Madam Chair, Commissioner Sturm.
Yes, Ryan, go ahead.
Kim, I have a question, and I don't know if you can speak to it very well or not. The hospital, St. Luke's Hospital, put out a tweet earlier this week that their Magic Valley facility was full. They were diverting patients to the Treasure Valley facilities for ICU, and that they were beginning to have meetings and discuss crisis standards of care. And so I saw that tweet, and I was curious if there was any validity to that, what if they've been communicating with you at all, and maybe Russ knows better too. I don't know, but I'm just curious if that's an accurate statement and that's where we're at. In that same statement, they mentioned that they were diverting. The Elko was trying to divert patients to our Magic Valley, St. Luke's, and we were having to turn them back. And so I just was wondering if we were in that situation currently.
Madam Chair, Commissioner Sturm, I know that conversations of crisis standards of care are going on at this point in time. I don't know the level of detail going into them, but I know that there is planning of what this looks like should we get to the point where those orders are needed to be put into place. I guess I would defer to Russ if he has any further information on that.
Russ,
I'm sure.
please. I'm sorry. Was that Ryan again, or?
It was Russ.
Okay, Russ, go ahead.
Sure. So I don't have much else to add beyond what Kim described, and as we'll review in the public health advisory on the next agenda item, the crisis standards of care is definitely something that is being discussed, and the information, Commissioner Sturm, that you're talking about, I don't have anything beyond what you've shared, and we've talked about that a number of times. And I know Commissioner LaCianda has brought it up. We're not on an island here in Ada County or 4 counties, but the impact to the health systems here in the Treasure Valley will be brought on not only by things going on in our communities, but outside of our communities, because this is pretty much the center of healthcare for most of this part of the state. So I think I'd be glad to follow up on that and get back to you, Commissioner Sturm, to see what I can learn, but I have no reason to believe that they'd be putting out information that wouldn't be accurate.
Thank you.
Betty Ann, this is Ted.
Yes, Ted, go ahead.
Yeah, a couple comments. I wanted to pick up on Elt's point about the emergency room visits. I totally agree with Kim. It's not a good measure, Elt. And the reason is a lot of patients with COVID-19 aren't going to the emergency room. They're going to primary care clinics. Why? Because it's a lot cheaper. So let me just share with you the experience both of our organization as well as primary health. We've seen all-time record highs in terms of the respiratory clinic utilization in the last couple of weeks. Our numbers are off the chart high in terms of the number of people coming in with COVID-19. And so the better metric of what's happening in the community that's in line with what Kim's talking about is what's happening in the primary care clinics, primarily just because, again, the access and the expense of going to the emergency room for this keeps people from going there. The other thing I just want to mention, and this is for the public's knowledge, because the public doesn't get this information, but the Public Health Department receives a report from the White House pretty much on a weekly basis. And I just want to reiterate a couple points that Kim's data also speaks to. First, in terms of the community-wide spread, I would say it's not just community-wide spread, it's aggressive community-wide spread. Idaho is in the red zone for this. We're the 15th highest state in the country right now with the number of cases per 100,000. We're double the national average for cases per 100,000. And we're the second highest state in the entire United States in terms of the positive rate in our community. So not only do we have widespread community transmission, we have aggressive widespread community transmission. And that's going to play into, I think, the next agenda item when we talk about what are we going to do about this at this point in time. So thank you, Chairman Nettleton, for letting me make those comments. Again, since one of the functions of the board is to be transparent to the community, I think it's important the community understands how the White House itself is looking at not only the state of Idaho, but what we're facing right now in terms of COVID-19.
Okay, thank you, Ted. Any further discussion questions for Kim? Okay, hearing none. Kim, thank you so much for your presentation. And we will move on to our next agenda item, which is discussion and vote regarding potential actions to protect the life, health, and safety within the district as to the COVID-19 pandemic, to include potential amendments to current public health orders and additional orders for other counties within Public Health District 4 or a public health advisory. Russ, would you like to comment on this item, please?
Sure, Madam Chair. But what I just wanted to start with, the circumstance we're in is not good, obviously, and it's pretty rapidly getting worse. We hear that daily now. I don't know if you watched the news this morning, where the Boise mayor with several of the healthcare representatives talking about their circumstances. That was clearly reflected in the data that Kim just shared with you all. And I came up with this idea of a public health advisory as a means to try to find the right balance between the communities who we serve, who are pretty opposed to the orders. I know, Chairman Nettleton, you mentioned our visits in Elmore County, and the message I guess I got pretty loud and clear from those visits is they want us to tell them what they need to do, but not do it by way of order. So this is definitely a different approach. We have used advisories in the past when things come up with a waterborne illness, for example, during the summer at recreational waters. We issue public health advisories telling people you shouldn't swim in that pond or that lake. So this is again, it's not our typical approach, but it's something that I at least wanted to offer to the board as a suggestion. So an advisory is not an order. There are strong recommendations by Central District Health to reduce risk in specific areas. Like I mentioned, foodborne outbreaks, waterborne outbreaks. This is the first time in 100 years we've had a pandemic. So I don't know exactly how applicable it is, but again, it's looking at giving our communities guidance on exactly what we believe they need to do to protect themselves, their neighbors, and their loved ones. And in the case of this pandemic, to ensure we can all continue to have access to healthcare over the coming months. So the order, before I get into it, I'm going to have Dustin pull it up here in a second, is that it's a combination of what our disease investigators are seeing in our community, and that includes the contact tracers, where people who are getting the disease are being exposed. It also includes the high-risk environments and activities that are likely to spread a respiratory virus. And it also includes recommendations intended to protect high-risk populations, such as those living in congregate facilities. It does not change the existing CDH public health orders that we have in place for Ada and Valley counties, or the orders that the Governor Little just issued. So those remain in effect. They are law, and violation of the orders are subject to a misdemeanor citation. Dustin, could you pull up the proposed public health advisory?
Madam
Okay.
Chair, this is Representative Blanksma, really quick, please.
Yes, Megan, go ahead.
So my question, I've read these, is it just an automatic deferral that these recommendations move over to public health orders that then incur the misdemeanor?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So, yeah, and we'll talk about that after I go through the specific recommendations, but that's the idea is, you know, people generally want to know at what time, what point does the advisory get lifted? And in most instances, like I described, that would happen when the threat is gone. It passes or was mitigated or resolved. However, in this situation, I am fully expecting, based on what we're seeing, that it's going to go the other direction. And that was the trigger point for these recommendations to become an order. And clearly there'll have to be more discussion about that. And maybe it needs to be worded a little bit different, but the recommendations would be written into an order, and then those would have to be approved by the board before they took effect.
Madam Chair?
Yes, Megan, go ahead.
Yeah, that was not my understanding with the what was written. My understanding is what the recommendations were written with an order to follow regardless of board involvement. I'm just trying to clear that up, please, Madam Chair.
Yes. Russ?
Madam Chair, this is Russ.
Yes.
Yeah, we can change the wording at the bottom of this public health advisory to make that clear if the board wants CDH to go ahead and proceed with this advisory. I do see your point. It doesn't clarify the process, but the process is for board approval before any orders would go into effect.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So, you know, I had a little bit opposite reaction to that section at the end, which is, you know, public health's role is to prevent the spread of infectious disease, and it's to ensure access to safe and quality care. If we get to a place where people like my husband have to decide who is getting access to care, we've already failed. So I struggle with saying it doesn't become an order until crisis standards of care, and literally having to decide who gets care at the hospital. I struggle with that. And I would actually, you know, we're talking about an advisory today, but I'd prefer to head down a path where we discuss what is the next metric to look at further orders in Ada County and maybe our other counties. We can't do it all here. And, you know, we heard from Dr. Souza when he was on a few weeks ago that I don't know that even us alone would be enough, but certainly we are the largest populace. So I guess I would just offer that as commentary that I'm uncomfortable with saying we aren't doing more until there's crisis standards of care.
Madam Chair, this is Ted.
Yes, Ted, go ahead.
I think we, because of the questions that were asked right in the middle of Russ's presentation, we jumped to the end. I would like for Russ to be able, uninterrupted, to be able to finish what the advisory is. And the reason is that there are a lot of people watching this that are getting pretty scared by this latter conversation. Let's go through the advisory, what's in it, and then we can discuss the action steps.
Okay, Madam Chair, I'll continue. And again, the points that were just made, totally understand, and we'll talk about that, and certainly I'll provide you my opinion when we get to that point. So the advisory that you see in front of you is for the counties of Ada, Boise, Elmore, and Valley. So in Boise County and Elmore County, we currently have no public health orders in effect at this time. Clearly, they are being impacted by COVID, pretty much at a very similar rate as to what we're seeing here in Ada County, but a much smaller population overall. So those are the counties we serve, and that's why I am recommending this advisory be issued for all 4 of our counties. So as you can see, I'm not going to go through these in great detail, but basically to start, you see individuals at the bottom of the page. We recommend face covering at all times around anyone who is not a member of your household when physical distancing of at least 6 feet cannot be maintained. So that's definitely more strict, if you want to call it strict, compared to the Valley County and Ada County orders where it's public places and schools and so on. But there should be no exceptions to this at this time, given our current circumstances, other than, as CDC has noted, for children younger than age 2, people who have trouble breathing, and people who cannot remove the mask without assistance. And then also people who are getting services like dental services where you obviously can't wear a mask at that time. Dustin, can you scroll down to the next page? We are strongly recommending that people work from home. Work from home when you can. Minimize non-essential travel. Suspend visits to congregate living facilities. We only have orders in Ada County that address congregate living facilities and the criteria that must be met. We also included a recommendation that when we have a positivity rate greater than 10%, the visit should be suspended. And as Kim just described a short while ago, we're well above that. So that would be for, again, all 4 counties that include pretty much jails, prison, long-term care facilities. Avoid social gatherings. And I'm not recommending a number. People need to avoid social gatherings, period, including among family members who are not part of your household. And I know this is a really tough message to deliver at this time as we're coming upon the holiday season, but we see case after case after case of family gatherings spreading the disease from one household to another, and then of course within the household themselves. We have information on our website on how to celebrate the upcoming holidays and do it safely. Anyone age 65 and older, or who smokes, or with a health condition that puts them at risk for severe outcomes should avoid close contact with anyone other than immediate household members, except for necessary services such as healthcare. And you can see in the open bullet below that, this is from Centers for Disease Control. These are the folks who will face the most severe consequences should they contract the disease. So then on to the next section, we have outings and activities in places of businesses. Businesses should implement delivery and curbside services when possible. And again, I understand that's not always feasible. What I'm advising at this time is if you can do it, you should do it. Places of worship should implement virtual services. And once again, I understand that not everyone would have access to the technology, but that's generally they're in a large gathering in close contact for a prolonged period of time. Discontinue youth and adult sports activities in which physical distancing is not possible. Kim shared with me a day or two ago over 25 instances where fairly recently we've had outbreaks or clusters occurring within youth sports. And this just is not just school associated, but also with club sports. They're clearly high risk with a respiratory virus. And the idea of wearing a face covering when you're playing basketball or wrestling, it's just not going to happen. Discontinue school extracurricular activities of all types in which physical distancing cannot be maintained. So this really speaks to the school activities and where physical distancing can be maintained. And I want to again make this clear, where there's increased breathing, such as choir and band. There's been a number of cases across the country where there's fairly significant outbreaks occurring in those environments, even when physical distancing can be maintained because of the large production of respiratory droplets doing those activities. Bars, restaurants, breweries, tap rooms, wineries, and distilleries should move to takeout, carry out only and close at 10 p.m. Again, it's a strong recommendation, and I understand bars, for example, make a lot of their revenue after 10 p.m. But we're in very near a crisis situation, and these are steps that I think are absolutely necessary so that you can stay open, but also help the community contain the disease in environments where we know it will spread. And the last item is gyms and other fitness or group exercise facilities and studios should limit their capacity to no more than 50%. I know a lot of the businesses out there, including bars, restaurants, breweries, and so on, have done a really good job with physical distancing, but we really need to step this up. So the idea is to reduce the capacity in those environments. Again, people go to gyms to exercise, you increase your breathing, respiratory droplets, etc. And then class instructors need to maintain a distance of at least 6 feet from participants at all times. We've had an instance where the class instructor was in very close contact with the class participants, even though the class size was limited, but close contact and a loud voice caused, again, a small outbreak to occur. So this is just based on what we're seeing and what we know of as high-risk environments. So the duration of the advisory, which is the conversation that we started a little bit earlier, is that it will remain in effect until a sustained 2-week decline in cases within our health district occurs and a 2-week case rate of less than 30 per 100,000 per day. Now, a good question to ask is, well, why 30? Where do you come up with that number? Well, we came up with a number, and I would call it an educated guess of 20 per 100,000 per day. And certainly advised me a number of times as far as, well, what that looks like with 20 per 100,000 per day over that 2-week period might not be a significant impact to the hospitals. But if you don't start to throttle things back at that point in time, they'll continue to burn out of control. And as she described, where you're looking at 70 per 100,000 per day with no slowing in sight, that's exactly what happened. So that was really tied to our recommendations around schools and the Idaho Back to School framework. So I think this is not only to see the decline, but we need to be under that 30 per 100,000 per day to feel comfortable where we wouldn't have to have the advisory in place or at least some provisions of it. Then the last part, which I get, I don't know exactly what is that perfect point of when our communities who prefer not to have orders in place, when will that be tolerated? So that is when one of our 3 health systems, St. Luke, St. Al's, or the Boise VA, implement crisis standards of care. And those are authorized by the state of Idaho. It's not just the hospitals saying we're in crisis, but actually a formal process that this advisory would be moved over into the format of an order. And again, my thought on that is it would be clearly too late to slow it down. It would take us several weeks. And what I would envision happening is we would end up at stay-home orders like we had issued on March 25th. So, some members of our community seem to still want to debate the effectiveness of masks, but I don't think anyone in our our community will tolerate our health systems being forced to decide who gets care and who does not. The last thing I just want to say, this is my plea to our communities, as we are heading into the most dangerous time of year for respiratory illness, COVID aside. Now we have COVID on top of everything else. Colder weather moves people indoors. The upcoming holidays are a time for gathering with family and friends. And it's the exact thing we want to avoid to slow the spread of coronavirus. So we really need all hands on deck right now and for the next couple of months. I know the vaccine's on its way, but it's going to be several months before it's readily available to the broader community. Likely it'll be spring and possibly as far out as early summer. So that is my my presentation on the public health advisory. Again, I don't know that I feel overly comfortable with that approach, but again, it's trying to find that right balance between issuing orders that in a lot of instances aren't actually being enforced anyway. And this particular document spells out exactly what we need to do as a community to try to slow the spread. I'll be happy to answer any questions.
Thank you, Russ. Questions for Russ?
Madam Chair, this is Ted.
Yes, Ted, go ahead.
First, Russ, I think you and your staff have done an outstanding job on taking a very serious situation and boiling this down into specific behaviors that the community can do. I like the approach of a strong advisory at this time as opposed to mandates and orders. I hope it's enough to catch the attention of the community. One issue that the advisory was silent on, and this is my question to you, Russ, was around schools and the potential of advice or an advisory to the schools in regards to online virtual training. I'm sure you've given that a lot of thought and had a lot of conversations. Could you share with the board and the community why that wasn't contained in the advisory as well?
Madam Chair, Russ?
Yes, Russ, go ahead.
Yes, Dr. Epperle, and that is something we definitely discussed on a number of occasions, both internally, talking with our schools, school administration, school superintendents, Idaho State Board of Education, trying to figure out what is the right step. As everyone may remember, back in July, when the Idaho Back to School framework was put together, it said specifically when you get to red or category 3, there were 3 categories at the time, schools should go virtual. So now that we're a few months into school, our schools, we know, have really good plans that they've implemented. And bottom line is what it comes down to, the question, are kids going to be safer outside of the school in an uncontrolled environment where they may be staying with grandparents to try to learn virtually, or gathering with, I've heard of families who maybe one parent will take multiple children to help them with virtual learning. They go to childcare facilities, or in the case of the older kids, there's been I'd say an extreme amount of concern for them failing. And again, failing and COVID are 2 different issues, but they're both significant health issues and public health issues, looking further down the road. So the bottom line is, the question that actually one of the school superintendents asked me is, Russ, do you feel confident that kids moved out of the school setting for 6-7 hours a day out into the community will slow the spread, or won't it? And my answer is, I don't know. And in fact, I don't think it would, because our schools have been great partners in this effort. They have the kids physically distanced. They have them in pods. So if there is an exposure, they don't expose multiple other kids. They wear face coverings. And when somebody tests positive, they're not allowed into school. And they've been actually helping with contact tracing because we have so many cases. So I know that was a a long explanation, but I think the bottom line is, as the public health director for Central District Health, I couldn't assure our schools or our communities or this board that our kids would be any safer outside of the school setting. In fact, I would question the fact that they probably could even become more likely to be spreading the disease, given that they're in an uncontrolled environment 7 days a week, whereas otherwise they have at least 3 or 4 or 5 days in the school where they have some oversight.
Thank you, Russ.
Thank you for that explanation, Russ. I think that'll be very helpful to the community to hear the thinking.
Madam Chair, this is El.
Yes, Al, go ahead.
So Russ, would you kind of guesstimate, I know it's not our call, it's the governor's call, but this is like the last step before we go back to stage 1?
Madam Chair, it's Russ.
Yes, Russ, go ahead.
Yeah, Commissioner Hasbrook, I know our communities really kind of became accustomed to that stay home order, stage 1 through stage 4. And in fact, when you recall, when we issued our first set of orders here, we were aligning them with stage 3 and then moved away from that because our orders look quite different. And even the governor moving back to earlier stages, it comes with modifications. So I don't know what the governor is going to do next. I know he's hopeful that his recent changes will turn the situation and start us in a downward trend for cases. But if it doesn't happen, I would envision, like you said, stage 1, and ultimately, if the hospitals are impacted, as some are predicting, I'm not sure we'll have any other choice but to look at stay home orders. And I'm not saying the governor or us specifically, but we're going to have to work on this as a community and get this figured out. Because as you all know, when our neighboring public health districts have no restrictions in place at all, those folks still come to our community for healthcare. So we really need to figure out a plan to work on this together. And I think the statewide approach is better, and especially where you're seeing the COVID cases pretty much in every county in our state on the increase.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So I want to sort of pick up on the schools issue, and this is where having these weekly meetings is so important, that we can voice the questions that we get. Boise Schools has decided that after Thanksgiving, they're going virtual, and it largely does not have to do with COVID. It doesn't have to do with COVID transmission in school at all. It has to do with the amount of staff being impacted and their lack of ability to get substitutes. We're hearing the same concerns in Westata. They haven't gotten there yet, but they, have tons of people out on quarantine. And so the question that I keep hearing and getting, and I certainly think about this as well, if we want schools to be a priority and we want kids to be in school because we know it's a safer place, we know it's better for families, for the economy, for mental health, for all the things, then again, this is the question I keep asking: what do we need to do to prioritize that? And I'm hearing a lot of frustration from parents that bars are open, restaurants are open, things are happening in the community, while now we're back to virtual school in Boise. So what's your hot take on that, Russ?
Madam Chair. Russ.
Yes, Russ, go ahead.
Yeah, Commissioner Lasciando, I hear the concerns. We've really, I feel like we've done our best, both in public health, the Board of Health, trying to move us back to what we call the new normal, at least the new normal for a while. Bars, for example, they came to the board, they petitioned the board, they had a plan where they specifically described how they were going to operate, table seating only, bar tops closed, face coverings for staff, face coverings for patrons. So it's hard to argue like, well, you should stay closed even though you're operating just like a restaurant. Now, granted, I know there were a few out there because we did spot checks, and they'll be getting letters in the mail any day now because they were sent out yesterday with clear, blatant disregard for following the order. So, it's definitely desirable to try to figure out an approach where you have people that are trying to do the right thing and that are actually doing the right thing and not essentially penalizing them for the bad actors out there. Now, obviously, it doesn't seem to be working. I think we have so much activity going on in our communities. You think back to what it looked like in end of March and April compared to today. It's hard to tell that there's a pandemic going on. Now, when I say that, I do think I live in Boise, and I think people are really trying to do the right thing. When I stop at a grocery store or a hardware store, most people are wearing face coverings, and I'm really impressed by what I'm seeing with the staff at these facilities. So I don't know, what to say to a parent of a student of a Boise school district other than everything I just covered in that public health advisory. That actually does include the celebrations, the school celebrations, the family gatherings that you get together that includes school-age children. It's not, like you pointed out, we're not seeing a flood of cases coming out of occurring within the school, but it occurs within the school community or teachers or staff or bus drivers getting together. So like I mentioned, we just need a community-wide effort, and I don't think right now is the time to maybe place blame on one particular business or industry or individual. I just think we need to do the things we've been talking about forever, and like I outlined in the public health advisory, I think if our communities in all 4 counties follow those strong recommendations, it's my sincere hope that we'll see a decline in cases in the coming weeks.
Okay, thank you, Russ. Further
Deanne, this is
Yes.
Ted. I'm prepared to make a motion.
Okay, go ahead.
Yeah, Russ, again, I think this is well done, well thought through. It's level-headed, it's practical. We've got behaviors that are identified for an advisory. You've got clear data in terms of how long it lasts. You have an exit strategy in terms of number of cases per 100,000 at 30. We're right now sitting at about 60 on our way to 73. So it sounds like we might be here a while. And it also has an escalation from advisory to becoming a public health order if things the bottom falls out and the public just doesn't pay attention. So because of the good work here, I make a motion that we accept and approve Director Duke's advisory orders to include Ada, Boise, Elmore, and Valley counties.
Okay, the motion has been made. Is there a second to that motion?
I'll second that. This is Diana.
Madam
I'm
Chair,
sorry,
this is Representative Blanksma.
Yes, go ahead.
I would just ask that we have the opportunity to review it before it becomes an actual order. I don't know that I disagree with the recommendations, but if it becomes an actual order, I think that should maybe come back to the board.
I would agree.
Okay, thank you. Was there Diana, was that you seconding the motion?
It was, thanks.
Okay, thank you.
Madam Chair, point of order. I would just say that Dr. Epperly would have to amend his motion to say that it has to come back to the board before it becomes an order, and he would also have to have the agreement of the second.
Okay, Ted, would you do that, please?
Yes, Betty Ann, I would be happy to add that. I think that was implied, but I will absolutely make that clear that this is an advisory set of orders. We would not escalate this to become a public health order. In regards to that, it's advisory at this point without it coming back through the board. So I would add that amendment as indicated.
Okay. Thank you, Ted. You've heard the amended motion. Diana, are you still willing to second that?
Yes, ma'am.
Okay, thank you. Any further discussions before I call for a vote? Okay, hearing none, I will call for Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, I.
Ted Epperly, aye.
Commissioner Lachando, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks. That motion passes. And that brings us to the end of our agenda. However, I want to clarify, we talk about the time of our supposed next meeting, which is now the 1st of December, depending on what Director Duke and I decide. Russ, I've had some requests to think about returning these to the 5:15 hour rather than 8 o'clock.
Madam Chair, I would recommend that you return to the 5:15 hour.
Okay, thank you. And I don't think that we need a motion to do that, do we?
Well, Madam Chair, this is Representative Blanksma.
Yes.
I would make the motion just so it's clear that we return the meetings to the 5:15 hour going forward.
Okay, thank you, Megan. Is there a second to that motion?
This is Zelt. I'll second that.
Okay, thank you. Any further discussion before I call for a vote? Okay, Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, I.
Ted Epperly, aye.
Commissioner Lachando, aye.
Elmore County.
Representative Blanksma, aye.
Okay. So our next meeting tentatively is scheduled for December 1st at 5:15. You confirm that, Director Duke?
That is confirmed, and we will update the schedule accordingly with the exception of the December 18th meeting, which will start at 8:30 a.m. And that's the much longer meeting, the normal meetings that we have.
Okay, thank you so much. Okay.
So, Madam Chairman, this is Representative Blanksma.
Yes, Megan, go ahead.
Motion to adjourn.
You've heard the motion to adjourn. Is there a second?
Madam Chair, Commissioner Sturm, I'll second.
Okay, thank you. Any further discussion before I call for that vote? Hearing none, I'll call for Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, I.
Ted Epperly, aye.
Commissioner Lachando, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you. The motion does pass, and I want to thank everybody for their participation tonight, and particularly the public who's been listening in.
Betty Ann.
Yes, Ted.
Betty Ann, I'm sorry to interrupt. I did, before we ended, I wanted to just mention one thing. I think all of us received some really good work from Central District Health in terms of some holiday, celebrate upcoming holidays advice to the community around both Thanksgiving, Christmas, New Year's. I just wanted to compliment Russ and the staff for putting this together. I think it's extremely well written. It presents a range of choices for people. It speaks to all the issues, and to the public listening, if you are wondering about how you should go about the holidays, here's some great recommendations from Central District Health for you. And again, Russ, thank you to you and your staff for putting that together.
Okay, thank you. All right, folks, the meeting stands adjourned, and thank you once again for your participation. Have a good evening. Goodbye.